Hello everyone, welcome to this lecture, Natural History of Disease. That means the way in which a disease evolves over time from the earliest stage of its pre-pathogenesis phase to its termination as recovery, disability or death in the absence of treatment or prevention. So the early stage of pre-pathogenesis to the terminal stage. How disease evolve over this time, that is natural history of disease. There are two phases in it, pre-pathogenesis phase and pathogenesis phase. In pre-pathogenesis phase, the process is in the environment. Disease agent not enter the man. This phase starts with presence of causative factors and ends with interaction of these factors. Agent, host and environment. For example, agent is TB bacilli, environment is overcrowding, and host malnourished individual. So this interaction initiate the disease process in the man. So the prevention technique applied here is primary prevention and interventions, health promotion and specific protection. We'll study about this later. And second phase is pathogenesis phase. This is the disease process in man. Two phases here, early pathogenesis and late pathogenesis. This one starts with entry of infectious agent, and then after the entry, agent will multiply in the body, and then end stages, pathological changes will be there in the body. So there won't be any symptoms. Prevention applied here, secondary prevention, and then interventions applied here, early diagnosis and the treatment. The last subphase is late pathogenesis phase, starts with sign and symptoms and ends as recovery or disability or chronic stage or death. So the prevention method applied is tertiary prevention and intervention, disability limitation and rehabilitation. Now concepts of prevention. Prevention techniques applied to interrupt the natural process of disease. So there are four prevention: primordial, primary, secondary and tertiary. Now primordial prevention, prevention of development of risk factors in a population in which they have not yet appeared. So risk factor is not there. So the mostly child group is not having risk factor. So the intervention applied here, mass and individual education toward the children. And then primary prevention, action taken prior to the onset of disease, which will remove the possibility that disease will ever occur. So risk factor established here, but disease not yet occurred. WHO recommended two approaches, population strategy and high risk strategy. Population strategy, also called mass strategy, apply to entire population. For example, health education about hypertension for the entire population. And then high risk strategy apply to individual, whoever is having risk of hypertension, old age people and then males, family history of hypertension. Like this group, risk group, we are going to apply the intervention. Now interventions are health promotion and specific protection. Under health promotion, we have health education to promote the healthy behavior, and environmental modification, adequate water supply and then sanitary conditions, standard housing and all. Nutritional intervention, food fortification, food distribution, food programs. The lifestyle and behavioral changes can be sound sleep and good nutritious diet and physical activity, no addiction, stress-free life. In 1896, there was an international conference in Ottawa for health promotion. The strategies are enable, mediate and advocate, under which we have build healthy public policies. So consider health in all policies and generate supportive environment for health without pollution and good water supply and adequate housing standards, and strengthen community action for health and allow community for the planning of the health, and develop personal skills regarding health, and reorient health services from curative aspects to preventive and promotional aspects. And second one is specific protection. That specific protection is directed against specific health condition. For example, we have immunization, chemoprophylaxis, use of specific nutrient, protection against accident, protection against occupational hazard, protection against carcinogens, avoid of allergen, control of pollution, consumer product quality, safety of food, safety of drugs, safety of cosmetics, etc. Now, secondary prevention, action which halts the process of disease in its incipient stage and prevent complication. Here we have risk factor, disease, there can be symptoms or not, and government health programs are applied at this level. The secondary prevention methods are expensive and less effective as compared to primary prevention methods, and which reduces the prevalence by shortening of duration of the disease. Intervention applied is early diagnosis and treatment. We have screening programs and routine checkups. So the, for example, BSL and BP and sputum smear can be applied as a screening test, and treatment we can start anti-diabetics and antihypertensives, anti-tubercular drugs at early. And tertiary prevention, all measures available to limit the impairment and minimize suffering. So here we have risk factor, disease, and complication. So interventions apply to limit the disability. Here the aim is to prevent the transition of disease from the impairment to handicap. So the prevention applied between impairment to disability or impairment to disability to handicap stage. Impairment is any loss of anatomical structure or physiological function. Disability, not able to uh, do an activity which is considered normal for that individual. Handicap, cannot fulfill the role in the society. So, for example, take cataract as an example, and clouding of lens, impairment, can't see is disability, and can't work is handicap. And take second example, RTA, in that loss of limb will be the impairment, can't walk, that will be disability, and handicap, can't work, that will be handicapped. So last one, quaternary prevention, prevent harm from medical interventions. For example, avoid unnecessary antibiotic or investigations. So we are at the end of our lecture. So we have covered natural history of disease, in which we have pre-pathogenesis phase and pathogenesis phase. Pre-pathogenesis phase, presence of causative factors to interaction of that factors. Pathogenesis phase, we have early pathogenesis phase and late pathogenesis phase. Early entry of the organism to the pathological changes. Here, signs and symptoms to the an end or recovery or death. And then we have studied about concept of prevention. So prevention, we have primordial prevention, we have primary prevention, and we have secondary prevention, we have tertiary prevention, we have quaternary. Usually we'll be writing up to this much for the exams. So the primordial prevention intervention is mass or individual education toward the children. The primary intervention is health promotion and specific protection. Here secondary, early diagnosis and treatment. For tertiary, disability limitation and rehabilitation. Hope you understood the lecture. Thank you for listening.